When the Lancashire Shared Care Record came along, it was manna from heaven. All of a sudden, at our fingertips, I could dial a patient up and find out exactly what medicines they took, what they were allergic to, and I could do it 24/7 in the evening, at weekends. Things which used to take almost an hour, we could do we could get the information instantaneously. We still have to speak to the patient to confirm certain things, but it was a light and day difference having the shared care record.
Our families are really happy that we have the information from shared care records because it allows them to only tell their story once, but more importantly, they feel secure in the knowledge that we have the right information from the hospitals, from primary care, from the tertiary hospitals and the specialists. So they're not having to carry lots of information around with them or repeat themselves.
When I do a pre-admission assessment, I will ask them for their NHS number. I will explain what the shared care record is and explain to them if they can't remember all of these things, or what medications they take, or what other things that they've had that are relevant to their care needs and how it impacts them in the care home. I can look it up and I can fill in the blanks. And the moment of instant relief that just washes over them, and then they feel relaxed and we can have a good pre-assessment, and I know that I can find all this information when I get back to the office.
The Lancashire and South Cumbria Shared Care Record saves time for every health professional involved. At the point of care when someone rocks up either for an appointment or unscheduled, at your fingertips you can find out exactly what you need to know about their continuing care from the GP record, but also from hospital discharge letters, not just from my hospital, but from Preston, from Lancaster. They all go into the shared care record. So wherever care's taking place, we've got the information about what happened, what was planned to happen next, and how that affects the current encounter we've got with that patient.
Shared care record has also allowed us to share information with the multidisciplinary teams, for example, health visitors, school nurses, education, social care, and also the wider multidisciplinary teams at the hospital. It allows us to have that real-time information, so giving us the best opportunity to communicate, to share information about where the child's up to, what's happening, and allow us all to work together better.
So the shared care record for me has allowed me to go back and have the time to have a look at a person's history and records and investigations, think to myself, these things aren't quite right, perhaps this is the cause of what is going on for my resident, and then that has allowed me to take that information, discuss it with the GP and say, I've noticed this on their investigation, they've looked into it further, and then actually come up with that this is what we should be doing for this person because of this and this, which I wouldn't have had a clue about had I not had access to the shared care record.
The question's often asked, what do patients think about having the Lancashire Shared Care Record and having health professionals accessing this? And the irony is, many of them don't realise it even exists, but there's a kind of tacit assumption that information about them is available to health professionals when they need it.
I genuinely do not know what we used to do before we had the shared care record. It has been an absolute godsend. It now allows me faster access to information.
I absolutely believe that this will save lives and support lives going forward. So a big thank you to the team at the ICB. Thank you.